I'm here to talk to you about end-tidal CO2 use during codes. There's quite a few benefits of end-tidal use during code situation. The first thing I want to do is show you guys how to set this up and where the supplies are. So our Zoll monitor here can monitor end-tidal CO2. All right, what we'll need is a Capnistat 5. This is always attached to the back of every single Zoll monitor we have in this hospital. But you will also need, it's called an airway adapter. All right, this is a single patient use only. It is a small clear plastic bag. It is located in the respiratory tray, along with that ambu bag and mask as well. So what you'll do, you will retrieve the ambu bag and the airway adapter from the respiratory tray. Go ahead and get everything opened up. Okay. This adapter simply sits snugly and will clip into place on the Capnistat 5. All right. You can use end-tidal CO2 monitoring before an advanced airway is in place. So best practice is we can go ahead and get this on as we start to bag our patient. All right, it really will only fit on the BVM only one way. So we'll fit that snugly into place. All right. Now we'll go ahead and we'll turn on the Zoll monitor. All right. Now we'll be able to see an end-tidal CO2 reading here in the box, but we can gain more information if we're able to visualize the patient's waveform or end-tidal CO2 waveform. So to be able to get that to display, you're going to click the options soft key. Okay. Click this traces part here. And then best place probably to put that tracing is trace 3. You'll click end-tidal CO2. All right, right now I don't have this attached to a patient. We're not actually ventilating anyone. So again, our waveform is flat. You will see the end-tidal CO2 reading at the top, okay, along with the patient's respiratory rate here at the bottom. All right, so what we can gain from this information is, say we are bagging our patient, the emergency doctor comes up to the bedside and intubates the patient. This adapter now can be fit onto the bottom of it or the top of a ET tube, okay? At that time, we'd look here for an ETCO2 reading. If we have one, all right, we know we have a confirmation of airway or correct ET2 placement. So not only can we measure or can we see if we have correct ET2 placement, ET2T placement with this capnography ETCO2 waveform, but we can also evaluate the effectiveness of our chest compressions. During cardiac arrest, ETCO2 serves as a surrogate of cardiac output. We really want to aim for an ETCO2 of we aim for greater than 10, but we really want to shoot for a end-tidal of greater than 20, okay, during codes. That just means we're having effective chest compressions. Now, what we can also see is if we see a gradual decrease in our end-tidal CO2 as we're doing chest compressions, that could possibly indicate chest compressor fatigue. So maybe it's time that we have that compressor switched out. We're doing some CPR coaching, making sure we're doing effective, high-quality CPR. Some other interesting, excellent uses for end-tidal CO2 is actually detecting it may be the first sign of ROSC for a patient. Obviously, that patient's intrinsic heartbeat is better than us compressing on the chest. So if we see a dramatic rise in end-tidal CO2, any point during cardiac arrest, CPR, we can think to check for a pulse. All right, and I'm talking a value probably greater than 50 here. See a value of 20 go up to 50, we want to check to see if that patient has a pulse. And let's say we've done a great job, we've achieved ROSC, we have a pulse now with our patient. We've just done a code here on the ortho floor. We need to get that patient to the ICU. Traditionally, we'll hold the Doppler in place to make sure we still have a pulse. End-tidal kind of will give us that information without the annoying Doppler sound. We can simply leave that end-tidal in place as the patient's being ventilated. If we start to see that ETCO2 decrease, we know we may be getting ready to code that patient again. So get your epinephrine ready, get ready to resume chest compressions. This is Thomas Skinner with another tip on how to use end-tidal during a code.